thinking out of the box in your the daily dentist practice, thinking not only on the tooth you're working in, is thinking about how you are moving your body, how you're moving your hands, how you're related with your assistant, how you're positioning your patient, how you're using the microscope, how you are respecting your posture, the entire procedure. Okay, my name is Juan Carlos Ortiz Hugues. I am from Panama. I'm the president of the Academy of Microscope and Dentistry in the United States and author of the book Ergonomics Applied to Dental Practice, published by Quintessence.
So what do you think about the dental world? Do you enjoy the event and its atmosphere?
The atmosphere is amazing. This is a really high-end conference. It's my first time here, and I'm quite surprised. I have been around many dental big conferences in the United States and Latin America, and for sure this one is a really great one that I will recommend to everybody to come. You know, the atmosphere, the vendors, the venue, and obviously the city is amazing.
What are the most common ergonomic errors you observe among dental professionals when using microscopes, and how can they be corrected?
Okay, many professionals and many microscope users are using improperly the microscope, and they are not using it 100% of the working time. This is a tool designed not only for precision. This is a tool that will protect your body the whole procedure. So if you want to keep good health, long-term practice on time, and also a better workflow, more efficient, training better our assistant, and protect ourselves during the work activity, we need to use a microscope properly. And that's the most common mistake among high magnification users. Also, not training the assistant is another variable, and also not having following a systematic positioning approach.
What specific training or workflow adjustments do you recommend to have the dental team, including assistants, maintain ergonomic efficiency during microscope-based procedures?
The assistant is a key component into the ergonomic workflow. Training the system, taking time to train the system in order that she can handle or he can handle all the what is going on outside the field of view of the dentist using the microscope is a key, is fundamental, because that way we as operators can protect our posture the whole time, and we can just minimize our motions, minimizing then the mental and the physical fatigue.
What role does magnification play in reducing operator fatigue and enhancing the quality of clinical care over the long term?
That's one of the beauty of the microscope in this case, is that with just one tool you can minimize or maximize the information you have, minimizing the fatigue, because when using it properly you will work in neutral posture, and then you will protect the full time your body and your capacities and your skills. The precision is multiplied by 5 to 6 magnification steps, make you able to reach the motor skills you need for precision and detailed work in the mouth of the patient.
What is the take-home message of your lecture?
Is thinking out of the box in your the daily dentist practice, thinking not only on the tooth you're working in, is thinking about how you are moving your body, how you're moving your hands, how you're related with your assistant, how you're positioning your patient, how you're using the microscope, how you are respecting your posture, the entire procedure. Is thinking out of the box, is thinking about yourself to make yourself do the best job in a long-term career. Well, I'm really pleased to be here, and I want to invite you to the 2026 Dental World Meeting. This is a fantastic city. The scientific program is really well organized with multidisciplinary dentistry, with high-end speakers. The organization is amazing. The people is amazing. So come to the 2026 Dental World, that you will have a great time and you will learn a lot.